That 94% of those who have died from COVID-19 died from other causes. Well, that finding has been a source of acrimony on social media, where accounts are being flagged for the possible spread of misinformation. LEX18's Michael Burke tried to get to the bottom of the numbers.
The CDC is playing with the COVID-19 fatality numbers, claiming just 6% of all coronavirus deaths are due to COVID-19 exclusively.
They've lived to this point and this long with those conditions. It's COVID-19 that has exacerbated their illnesses.
And no, the health department does not feel as if old age is the most severe risk category.
Looking at Kentucky, we are an obese state. We have one of the highest obesity rates of adults in the country. That's an underlying condition. So 1 in 7 Kentuckians have diabetes. 1 in 9 have pre-diabetes, underlying condition.
And coronavirus, as we know, can trigger life-threatening issues in those people as a result. But let's say the experts were willing to accept the CDC's numbers at face value. There's still another harrowing fact to consider about that 6%.
So that's very troubling, that people who are otherwise healthy are getting COVID-19 and dying from it.
Social media outlets aren't accepting this information, flagging accounts for tweeting and retweeting. That includes the president's. It's been 176 days since Kentucky's first case of COVID-19, which is not nearly long enough to know what the long-term effects might be.
There's so much more to COVID-19 than just getting COVID-19 and dying and getting COVID-19 and recovery. That unknown is very troublesome.
And in the health department, so is tweaking death tolls.
Misinformation spreads faster than the virus, it seems.
In Lexington, Michael Burke, LEX18 News.
And Kevin added that the coming flu season could be a bad one for positive cases, as more physicians will call for testing rather than relying on symptoms, as they often have done in previous years.